Hey guys, welcome back to the channel Side Dental Vlogs, and I'm Dr. Abhishek back with another video. So if you don't know me, I make videos on dentistry, dental related topics. So off lately I have I have got many DMs, many messages in my inbox, many email IDs that we are very much disappointed with our career and we are not interested in this anymore. I want to leave dentistry. कोई मुझे बोल रहा है कि सर व्हाट इज द स्कोप ऑफ MPH, MAH, हाउ मच इनकम कैन यू मेक आफ्टर डूइंग BDS or after completion of BDS. So I want to make a video on this topic particularly because from the past 1 month, 2 months, and this is a very common query so I thought I will motivate the students, motivate people to don't leave dentistry and make videos regarding motivating persons, motivating people. So I have never made a topic directly on this. So what is the cause basically? So first of all, the thing is, it's the process, right? It begins from the class 12th itself. Whenever we are preparing for after doing science, we are preparing for MBBS, right? हम लोग सब MBBS करके then we shifted to BDS because we could not get in MBBS. This is the first thing which we commonly encounter. Everybody wants to do MBBS, but because of less rank or because of some low score, we are not able to get it and we jump into BDS. So from the very first day, nobody has particularly okay, I want to become a dentist. ऐसा किसी का नहीं होता है. तो right, the inhibition comes from that point only. Inhibition comes from the very beginning. मेरे पास भी ऐसा हुआ था oh shit, I didn't get MBBS. What shall I do now? And okay, let me join BDS. It's a compromise from the very beginning. मतलब ये I don't want to dishearten you people, but this is a true fact what I'm saying. So whenever we join BDS, already we are sad that okay, we could not get into MBBS and we do BDS. And the initial start of the career, it's very difficult to cope up. In MBBS there are classes and all. Here also there are classes, but there is a lot of practical work, a lot of instruments. Then somewhere in our mind we think, yeah, so much expenditure is there in this. We have to buy this, we have to buy that. It's so worthless. I should not have joined. So initial 6 months of depression will be there after joining BDS. In our time, when I was doing my BDS back in 2002 or 3, I think 2003, when I joined. So at that time, I used to see my teachers and all. They were very happy, and the college was also very good. College was very strict. But nowadays, especially for the seniors and interns, I would like to request that whenever you are interacting with the first year or a second year junior of yours, never dishearten him by saying that these kind of words यार BDS में तो कुछ नहीं रखा है. There is nothing to do in BDS. There are no jobs in BDS. There is nothing is there. So if you demotivate like this, right from the first year, the student will lose interest in studies. Am I right or wrong? Right? From पहले साल से ही the student won't read properly. They worry, यार, what's the use of reading? I am passing just like that, just for the sake of my parents. I just get a degree. I'll go out from here. I'll start doing MPH, MAH. So from the very beginning, students are starting to learn about MPH, MAH. They are gaining knowledge about all these other things apart from BDS curriculum, rather than concentrating on what they are doing at present, right? So my sincere request to all the students of first year, second year, third year, ki never ever think about the future right now. Right now, do what your duty is, what your job is. Your job is, abhi mera job hai, I go to the clinic, I teach students, I work on the patient, I take care of my family, I take care of my expenses. Your job is, your parents have admitted to your course. आपका ड्यूटी ये है कि you should study well, you should do your course in a proper way, you should finish the course in a proper way, you should abide by the discipline of the college, you should go to the college regularly, and do not think about all those things, what will happen in the future. I'll give an example. Few years back, when people were doing engineering in my time, 1990, it was considered as the most worst profession at that time. According to me, means there were no jobs. 1990, 2000 के time पे there were no IT jobs. People used to just sit After engineering, nothing was there. But after 2000, there was the IT boom, and people from even small colleges, they got jobs everywhere. Still, the IT is in boom. Everything you are doing by app. You are opening Facebook, Ola app, Swiggy, everything. The IT boom sector is there, right? So initially, जो down period चल रहा था engineering student में, तो वैसे the people who had done their engineering were they disheartened. Now they are in very good position. They are in very good job. Likewise, anything can change with time, right? Long back there was a trend of keeping beard, but now in between they all used to shave. Then again the beard has come, and this way the cycle repeats itself. Just for example, I'm saying, right? So ऐसा नहीं है कि you go to the college having this much beard. So this is the thing now that things changes with time. Okay, क्या पता आगे फ्यूचर में गवर्नमेंट कुछ ऐसा चीज निकाले जिससे मतलब ऐसा स्कीम निकाले या फिर जिससे ऐसी चीज निकाले in which the doctors dentists will be like they will give a lot of jobs, and it can be also like that the government may start dental insurance. Abhi to now medical insurance is there, all the expenses are like they are borne by the companies like Star Health and so many Reliance, so many companies are there who bear the expenses for health medical insurance. But in the near future you may like encounter with dental insurance, and dental insurance, if it is there, patients will come more for dental treatment. So the scope always keeps on changing, right? Her field mein, not even this field, every field the scope keeps on changing. You only have to do the hard work. You only have to do you have to give your sheer energy and wholeheartedly, passionately, you have to do your work. Jo assignment, whatever is given to you, complete it in time. Finish your quotas, not in time. Finish your quota properly by doing the correct method, by yourself, not by giving to your senior, junior, friend. You should complete it yourself. Then only you will get the confidence of doing. All dentistry, the work is within the hands, and you have to improve your dexterity. You have to improve your patient handling skills. You have to improve your hand skills too with time. And in one day it will not occur. It will occur over a period of time. That's why the course is there, BDS. First year you have difficulty, second year you have difficulty, third year you again will have difficulty, final year is the most difficult. Internship, very easy. But life after internship is something else. That is a different story. Intern will only able to tell you this story. What the struggle is there after internship. The tension of getting a job, the tension of marriage, the tension of opening a clinic, the tension of what to do after BDS. This question mark is always there. If I make a video on what to do after BDS, a lot of views will come. Everybody keeps only searching about that video only. What to do after BDS? क्या करें? BDS के बाद BDS करो यार, और क्या करोगे? क्लिनिक करो, दांत निकालो, एक्सट्रैक्शन करो, FPD करो, and happy dentist day to all. कल था वैसे, मैं आज विश कर रहा हूँ. कोई बात नहीं, एक दिन लेट होने से चलता है. Belated happy dentist day to all. And we as dentists, like, first of all, we should not criticize other dentists. The first rule is there, what I feel. Whatever mistake something has been done, or it's from the doctor's part or the patient's part, you don't know. You never know what the patient is telling, what the patient has understood, what the doctor has told the patient. So never criticize any dentist, and this is what I feel. And whatever you are doing right now, BDS, do it properly. Right? Do with your full concentration, full wholeheartedly. That's what I want to tell in this video. कि whatever DMs you are sending me कि sir MPH के बाद क्या करें MP, I really don't know what is the scope of MPH, because I am not into it. I have not seen any person doing BDS and settled as MPH and getting a job. I have seen people getting job, but it's not as like somebody from the college has come and like nobody is happy leaving dentistry and going into another profession. Just for the sake of money, people are leaving the profession and joining MPH, MH. But nobody is happy. Ask me. You may be happy, she may be happy, some people may be happy, okay, they are getting some 40,000. But if you really ask me what is the future scope, okay, 5 years, 6 years, you'll get a job, and after that, you'll be given some senior post. After that, stagnant. But in BDS, if your clinic runs well, from here you will go, no boundaries there. No above boundaries there if you flourish as a BDS graduate or you open a clinic with a lot of patients. Doing patients, you are doing charity. And after doing MPH, it's also a good option, I'm telling you. If you have to run your family, if you're not from that solid background, you need to find one job, but never leave your original profession, what I feel. Right? Never leave your passion. अगर आपको जॉब मिल रही है MPH करने के बाद तो करिए, कोई गलत बात नहीं है उसमें, लेकिन whatever your passion is inside, keep it alive. Right? आप सुबह में जॉब करिए, शाम को क्लिनिक करिए, नो प्रॉब्लम. हफ्ते में नहीं हो पा रहा है 3 दिन क्लिनिक करिए, हफ्ते में 2-3 दिन क्लिनिक करिए, लेकिन करिए. हैंड शुड कीप मूविंग. ओके, योर हैंड शुड ऑलवेज वर्क. यू आर बॉर्न टू बी अ डेंटिस्ट. भगवान ने तकदीर से आपको डेंटिस्ट बनाया, तो उसको छोड़िए मत, उसको परस्यू करिए एनी हाउ. ठीक है, तो आज का वीडियो यही एंड करते हैं, काफी लंबा हो गया. हैव अ वेरी गुड डे एंड प्लीज डू फॉलो मी ऑन Instagram Sai Dental Vlogs. Take care.